is Amanda Schmidt, and I am the Area Director for Business Development for Civitas Senior Living. So happy to be here today. We are filming our wellness topic, and this month we are focusing on giving the gift of vision. And I am here with Dr. Michelle Tran, optometrist, here in Arlington, Texas, and it is such a pleasure. Thank you so much for doing this for us.
Glad to be here.
So Michelle, Dr. Tran, I'd like for you to introduce yourself and tell us a little bit about your practice.
Oh, wonderful. I'm Dr. Michelle Tran. I've been in practice for over 15 years here in Arlington, Texas. I'm a primary care eye provider, so I take care of things beginning from glasses to health eye checkups. We also treat eye infections, different types of diseases that we do manage. So we do pretty much everything for all ages.
Oh, wow. Very good. Well, as you know, our communities, we specialize in independent living, assisted living, and memory care. So I wanted to ask you a couple questions focused at the senior population regarding the importance of health, maintaining your prescriptions, and going to have your visits with the optometrist. So actually that makes me think of my first question. What are your recommendations for people 65 and over for how often they should come to the eye doctor, come and get checkups?
Yes, we always highly recommend a yearly eye exam, sometimes more often depending on what we find, but a rule of thumb would be a good eye exam every year.
Okay, very good. That's not too bad.
Not too bad at all. Very easy.
And then, of course, if you find something, then it may be adjusted.
Correct. Yes. If we evaluate and we find that if there's certain diseases or different infections or anything, then we do manage it accordingly and with follow-up care.
Okay, very good, very good. What common visual deficits do you see in the senior population specifically?
Yes, very commonly we do see the beginning of cataracts. Some patients will notice a decrease in the quality of vision, although they can still see pretty much the same, but the quality is not there.
Mm-hmm.
So with cataracts, it'll affect most of the time their nighttime vision, perhaps if they're driving, also a lot more glare. So that's something that definitely we do see a lot in that population.
Okay.
Yes.
Is there anything else? What about, for instance, I'm thinking of like macular degeneration.
Correct. Yes. And other things that we do screen for and we watch every year is, of course, the overall eye health, including the back of the eye. So that includes evaluating their retina. We can screen for diseases like you had mentioned, such as macular degeneration, which does affect a lot on their central vision.
Mm-hmm.
We also screen for glaucoma, eye pressure in the eye, and just various retinal diseases. For instance, if a patient does have a history of diabetes, high blood pressure, any health issue, we commonly can pick that up before they even see their primary care doctor.
Wow.
Yes. So we have proper equipment that can take a picture of the back of the eye, or the doctor ourselves can dilate and we look inside. And a lot of times we can evaluate the blood vessels, the nerve layer, just things that you wouldn't really commonly see from the outside.
Right.
So the eye is, the window to the body.
Yeah, for real. Wow, that's kind of like, how dentists say the same thing. They can catch certain diseases, based on what's going on in the mouth.
Correct.
So fantastic. So next question is, how does vision loss affect seniors differently? For example, as you see people age when they are not properly addressing their vision, what effects do you see?
Yes, that can definitely affect their quality of life. A lot of them are still very independent. They like to drive, go out and about and be very active. So if you do have certain types of vision loss, it can affect your peripheral vision, central vision, and that can definitely cause, falls and everything like that too. And also if they do like to still drive, especially at night, the quality is not there. So that can be a safety issue. So definitely we do want to take care of our eyes, keep the vision, up to date. And I feel that's very important in that age group.
So this makes me think about like your vestibular system. What can you say about the key role that your vision plays in keeping you upright, working with the vestibular system?
So as far as like balance and everything like that. You do want to make sure that everything is in check. As far as also the vascular system, your, blood pressure can definitely affect your eyes. It can cause bleeding in the back of the eyes, for
Oh,
instance.
wow.
Also with diabetes, some patients aren't even aware that they have such diseases, and we can pick that up by looking at the vasculature inside the eyes. So that's something that's very important to keep up with.
Falls happen often when people can't see. So,
Yes.
and not just in the senior population, but if we think about like in the middle of the night when we get up,
Yes.
right? And the lights are not on, that's when we're going to fall. Why? Because vision has been
Correct.
taken away.
Yes, and that's with, like you had mentioned prior, is the macular degeneration. That can definitely cause, the central part of vision to slowly diminish. That can cause you to have different spatial awareness, and it's going to cause you to possibly miss some steps. The same thing with other diseases that affects the outside part of your vision, such as glaucoma, where you start getting tunnel vision. So that's something that we have to kind of watch and be aware of, because that can definitely cause missteps and falls that can, be very harmful, and quite, major injuries can happen.
Definitely, because if you think about it, whenever you're out and about in the community, and
Yes.
even within our communities, there's curves, there's stairs,
Correct.
that people have to navigate. And when your vision isn't functioning correctly, you can't see the stairs, or the stairs, 2 stairs look like
Yes.
1 step. I know that from personal experience, where 3 steps, I can't tell that it's 3 sometimes.
Yes.
Which I wear glasses for a reason,
Yes.
so that I don't misstep down stairs and curves and things like that. So it's really important. So that really, I had a question of how does it impact your physical function, and I think we've addressed
Yes.
that. So how does good vision improve quality of life?
Most definitely, it can help you navigate around your daily, living activities much better. You're seeing clearer, just like if you keep up with your glasses, take care of the cataracts if you happen to have those. And that can just allow you to do all the things that you like a lot better. If it's tennis, if it's just walking, jogging, just doing your daily activities, cooking, not, reaching for the wrong item, or
Right.
making sure, with just things like that, and being safe.
My husband, he didn't get his eyes treated for a long time. And I remember he was talking about how when he was a kid, when he first got glasses, he didn't realize that all of the leaves on trees were separate.
Yes.
And how pretty it was, because he couldn't tell because it just looked like globs. So
Yes,
if you think about it, I think some seniors will kind of maybe not even notice that is going away.
Yes.
But then when it's corrected, you can see the beauty in the world again.
And I hear that a lot with that population, where once they get their glasses up to date, or also have needed surgery, everything just looks different, but in a clear, wonderful way. And then they appreciate that very much. And, we're so happy when we see changes like that for them.
Yeah, that's amazing. That is truly the gift of sight.
Yes.
Being able to see the beauty in the world, and
Yes.
the colors of the holidays, and the little details of a grandchild's Halloween costume or Christmas lights or whatever.
Yes. And that's something you want to preserve and take very good care of. We only have 1 set of eyes. So that's something that, some things can progress very quickly if we're not careful and watchful. So like we had talked about, at least an annual, yearly eye exam would be good to kind of monitor and keep everything up to date. Because some things can progress very quickly, and that's something that needs to be catched early on.
Right. It can progress quickly, and left unaddressed, the damage can be irreversible.
Correct.
Or not, you can't get as close to normal.
Yes.
Depending on the damage, I would assume.
Yes. Correct.
Very good. Well, thank you so much for your time today. I really appreciate it. And Dr. Tran is a very busy woman, and we are so thankful that she took time out of her day to talk to us about the gift of vision.
Well, you're very welcome, and I'm happy to, and glad that we were able to do this.
All right. Thank you so much. You guys have a great day.